Ya Ali Madat. I hope you're all keeping well and safe. My name is Gulabuddin Sukhanwar and I will be your host for this evening. I'm live from Norway. Before I share the program for tonight, here are some highlights of the board activities this week. Tomorrow, we begin with the Golden Club at 12:30 p.m. consisting of faith and well-being talks. In the evening at 8:15 p.m., join the breathing exercise which can not only relieve frustration, anxiety and stress but is also good and great for the lungs. We kick-start some of the physical exercise this week with the chair and standing exercise classes on Tuesday with parades at 11 a.m. If that wasn't enough, once again, Bowley Beats will be on at 8 p.m. with the beginners class and 8:30 p.m. for the intermediate class for anyone wishing to keep fit and stay active, especially when the gyms and training centers are still closed. On Thursday, we have a number of activities starting with the social circle at 11 a.m. with a variety of stimulating programs. We have also Season 2's popular Talking Hands class, which is in week 6 of the 8-week introductory course to British Sign Language taught by Zahra, Farah, and Nabi. Next Saturday at 4 p.m., discover the benefits of baby massage as the Aga Khan Education Board and the Women's Activities Portfolio invite parents to join the second session of a 4-week baby massage course facilitated by a professional instructor. These 1-hour sessions are a great opportunity to bond with your baby and meet other parents and babies of similar age. The series is aimed for babies of 6 weeks up to Wendy Crowell. The course began earlier today and continues until Saturday, 6 March. I would also like to take a moment of your time to talk to you about the Women's Activities Portfolio, who have launched a new social media initiative. WAP recognizes. The intention is to spotlight brilliant members of our Smiley community who are actively involved and striving to achieve gender equality or challenge gender stereotypes. You can look out for all these spotlights on the Smiley UK social media platform each month. And now on to tonight's program, which is part of the Thinking Ahead series presented by the Smiley Council for the UK. The topic for today is all about thinking ahead and looking after your physical and mental health. This session is a conversation with Dr. Selina Rajan, public health specialist, and Dr. Adrian James, president of the Royal College of Psychiatrists in the UK. Dr. James is a forensic psychiatrist at the London Hospital in Devon, and is the former medical director of Devon Partnership NHS Trust. We hope you find this program useful and informative. That's all from me. I hope you enjoy tonight's program. Continue to stay safe, well, and home. Yali Madad.
So hello and welcome. My name is Dr. Selina Rajan and I am a public health specialist doctor. This talk is part of the Thinking Ahead series presented by the Ismaili Council for the UK. Today I will be speaking to Dr. Adrian James, the newly appointed president of the Royal College of Psychiatrists in the UK. Dr. James is a forensic psychiatrist at Langdon Hospital in Devon and is the former medical director of Devon Partnership NHS Trust. He's chaired numerous committees, including the Westminster Parliamentary Liaison Committee of the Royal College of Psychiatrists, and I'm very honoured to have the privilege to hear his thoughts today on thinking ahead and looking after our physical and mental health. Hello, Dr. James.
Well, hello, Selina. Thanks very much indeed for inviting me. It's a real honour and a privilege to be here on Ismaili TV. Thank you.
So the purpose of these talks is to explore the key issues that affect the lives and the livelihoods of the Ismaili community across the globe, and to encourage the community to think a little bit about what the future holds for them and how they can inspire change, positive change, for their own futures and for the futures of others. What we've seen during the times of the pandemic is that health has come into sharp focus for many, many people, and a number of those people would never have considered health concerns previously. And this has just as many connotations for mental health as it does for physical health. And today, the idea is to talk a little bit about the future of mental health and what issues there may well be for communities. In your manifesto, you talked about a priority of ensuring equity between physical health and mental health. I wonder if you could talk a little bit about what you mean by this and why this is so important to you.
Well, thanks, Selina. This is one of my 4 big priorities, and I want to set up a system so that people look at mental illness in the same way as you would look at physical illness. And I remember when I started as a doctor, as a trainee, there was a stigma about cancer. People didn't want to talk about cancer. People would be ashamed to have cancer. And I think many of us now would look on that and think, well, how could that be? That's obviously ridiculous. And I don't think that really happens at all now. But with mental illness, there's a shame associated with it. People don't tend to talk to their family and friends about it. It has got a lot better. So we need to encourage people to talk about mental illness so that people who need help can get the help that they need. And at the moment, if you've got, for example, a cancer, you've got about a 98% chance that you'll get effective treatments for that cancer. And I think all of us would agree that's a good thing. If you've got a mental illness, so this might be things like depression, anxiety, or obsessive compulsive disorder, you've got about a third of a chance of getting evidence-based treatment. And part of that is because people don't come forward because of the stigma, and partly because the funding of services is not sufficient to provide the services that everybody needs. And I think an important part of that is that people from some diverse communities find it even more difficult to access services. They see the services are not set up to meet their needs. And there can also be some more shame about mental illness in some communities. So I'd really want to encourage people to talk about mental illness, to seek help when they need it. And the services that we have, we've got to make them so that they meet the needs of all communities. So we've got to work with communities to ensure that's the case. So I want everybody who's got a mental illness to talk about it and get help, to get the help they need in a timely way so they're not having to wait for a long time, and also their outcomes. Mental illness is a treatable condition, and it's lots of conditions. It's not just one condition. It's treatable, and I want to see everybody getting good outcomes, but also having a good experience of their care. So when they go to get help, that they feel they're really listened to, that their needs are met, and that they get what they want out of an episode of care.
That's really helpful, thank you. And you talk a lot about these issues around access to care, but also a lot around health literacy and the relationship maybe between health literacy and stigma. And although health literacy has really improved in recent years, communities, I think, still have many uncertainties around what mental health is and what a psychiatrist does. So I wonder whether you could tell us, as a psychiatrist, a little bit about psychiatry itself, and what does a psychiatrist do when a patient needs to see you?
Well, we're full doctors, so we go to medical school as all other doctors, GPs or surgeons or physicians do. So that's normally 5 or 6 years learning about all aspects of medicine. And then when we finish at medical school, we do a couple of years normally doing short placements in lots of different specialties to get a really good grounding in the whole of medicine. And then psychiatrists decide that they're going to specialize in treating mental illness. So the more common forms of mental illness are depression, anxiety, obsessive compulsive disorder, and anorexia nervosa. People who have problems with misusing substances as well. Psychiatrists help people in those situations. And also the more serious mental illnesses such as schizophrenia and bipolar disorder. So those are the illnesses that we treat. And the great thing about psychiatry is that we have a range of skills, and we look at people as whole people. So a surgeon might be interested in just doing the operation, get the operation done, and the person goes. We like to get to know patients because we see all aspects of their life. So their friends, their family, their life situation, their work situation or voluntary work, everything that's important to them. So the social side of psychiatry is important. There's a physical side, so we use medication for depression, for anxiety, for schizophrenia, and we also use psychological treatment, so talking therapies, so that people can look at how they're thinking and how they're feeling, look at the sort of patterns of thinking. Sometimes people get into very negative ways of thinking and they need help to get out of a negative way of thinking, or patterns of behavior that become self-fulfilling and cause problems for the individual. We help them with those things through talking therapies. And psychiatrists tend to lead teams, so we don't work in isolation. So I have a social worker who works with me, a psychologist who works with me, an occupational therapist who will look at people's daily living skills and look at their work skills. I have teachers who work with me. I have physical therapists, so the physical side, physical activity is really important. So they work with me and I lead the team. And I also make sure that services are safe for patients. I'm overall responsible for the care of my patients. I need to make sure that the environment is safe, that everybody's properly trained, and some individuals, a very small number, are detained under the Mental Health Act, so people who are in real crisis, who need to be in hospital because they might be a risk to themselves or others. People with mental illness are very unlikely to be a risk to other people, but for sometimes they need treatment in hospital, and so the legal side of psychiatry, that's our responsibility as well.
That's really helpful, thank you. And I think really important to shed light on that holistic care, that the role of psychiatry is not just about prescriptions, that actually you look at people and you provide that sort of wraparound care. There are people who've talked about this sort of web of causation and oppression that underlies mental health, that actually the causal factors are really complex, and they have quite a role to play in that holistic care that you have to deliver. I wonder if you could talk a little bit about the causes of mental disorders and tell us how effective individual actions can be to promote mental well-being.
Well, this is a really important issue, Selina, and it's not too dissimilar to physical illnesses. There's normally a variety of different factors that lead to somebody developing a mental illness, and that's often the case with a physical illness as well. So some people will have an underlying genetic predisposition. The genes that you inherit from your family might mean that you're more likely to suffer from depression or anxiety. And sometimes if you look back through families, actually my own family, I had an episode of depression myself. When I look back through my family, there are quite a few people who have suffered from depression and been very successfully treated for that. So some of these things can happen in families, and part of that is a genetic vulnerability. But there are very few illnesses where if you got certain genes, you'll develop the illness. Something else needs to happen as well. And often this takes us back to our early life experiences, and particularly those who are socially deprived, who are poor, who are disadvantaged, and actually people from Black, Asian, and minority ethnic communities who have to who find so many things challenging because our society is not set up to fully meet their needs and make sure that there's full equality. They're really up against it all the time, and that can actually be a cause of illness itself. And then, of course, somebody might have a major thing happen in their life. So they might experience a loss or a real trauma. And actually, some of the things that are happening with COVID-19 at the moment, people are actually losing their lives, they're losing loved ones. That can precipitate an illness. So it's normally a variety of factors. And I think it's really important to stress that having a mental illness, it's not that individual's fault. Having a heart attack is not an individual's fault, and so it's normally a variety of factors, and the most important thing is that people come forward and that they receive some treatment. And we know that initially people were talking about COVID-19 as being the great leveler, but actually what it showed was that some people who were already disadvantaged were more likely to develop physical consequences and even die. And that's true also with the mental health consequences of COVID, that people from some communities, because we don't live in an equal society, and we really need to address that. And there have been lots of reports that have said that if you address the inequalities in society, you'll have less physical illness and less mental illness.
Absolutely, yeah. You said about the pandemic recently that actually we're really not all in this together, because we're not all equally affected by the virus, and that can really, the same thing can be said of health conditions in general, that we are an unequal society. So we know that particularly for COVID-19, but also for mental disorders, people from Black and ethnic minority communities are at greater risk, both of experiencing mental disorders and of having complications of COVID-19. And you've touched a little bit on this already, but I just wonder, how do you think that the pandemic may exacerbate some of these issues going forwards through the life course? So thinking about from children all the way through to middle age, and through to older age adults, and what can sort of parents and employers do to mitigate those impacts?
I think you're absolutely right, Sina. It won't affect everybody in the same way, and there will be some groups of people who will be more vulnerable. And if we look at the life course in relation to children, of course, they've not been having so much contact with friends and family. They're not been going to school, getting support from teachers. That's beginning to open up, but it is really quite slow. So I think that's been very, very difficult, and particularly where there are challenges at home. That school can be a bit of a refuge for children, and teachers are very good at identifying pupils who are having problems. Again, that's no reflection on families or them, it's just something that happens, and actually getting either informal help and support or working with child and adolescent psychiatry services. And we know that during the COVID pandemic so far, the referrals into child and adolescent psychiatry have reduced. So it is a big worry that children are not getting the help that they need, and where things are very difficult at home, that can be particularly troubling for them. At the other end of the spectrum, again, older adults have not been seeing psychiatrists or people within mental health services quite to the levels that they were. And of course, it's sometimes more difficult for older adults to get out of the house to seek help. They might be less familiar with online platforms for getting help. So they've got very particular challenges, which I've spoken to lots of people centrally to say that it's likely that there will be a second wave of COVID-19, and we need to be sure that we're ready for it, and that it should be a right that everybody has access to the internet, to they've got their computing facilities, or at least a smartphone, and that they're actually helped to be able to use them so that they can stay connected with friends and family, but actually contact medical staff, psychiatrists, if they need to do so. And we know that people from Black, Asian, and minority ethnic communities, and I know that term doesn't cover the rich complexity and diversity that it refers to, and that we know that the physical effects of COVID-19 have affected them adversely. Those terrible pictures of the people who had died from COVID-19 who'd worked in services, and people from BAME backgrounds overrepresented to a huge degree. And it's true also of the mental health consequences, because people who have found it more challenging to access services before COVID have found it even more challenging afterwards. And again, that's one of the reasons I want to make sure that we don't have a service that has all these difficulties before we go into a crisis, and then we've got double difficulties when we are in the crisis. So we're lobbying for more money, more services, so that the service can actually run at a sort of a reasonable pace for patients and for staff, so that if you have a real shock to the system like COVID-19, if it has to ramp up a bit, it's not too stretched, because that causes problems for everyone.
Yeah, and I think that's a really important point, that actually we started on very weak footing, and we know that disorders of the mind and brain are the sort of leading causes of disability in the world, and yet we know that they receive only a fraction of health budgets, not just in the UK, but globally. Actually, access to care is so poor, and yet many of these conditions are so amenable to treatment, and they're amenable to early treatment. Given the sorts of difficulties that people have had in accessing care through lockdown and the reticence of clinicians to refer, what do you think can potentially be done? What sorts of adjustments do you think can be made to try to improve access to care? We've heard a little bit about some teams doing walking, socially distanced consultations. Are there other sorts of adaptations or remote access support that you think is available that would be helpful for people to know about?
So I think we do want people to talk about mental illness so that they will come forward. We've got to make sure that everybody is digitally enabled, so they've got access to a smartphone. I've seen lots of innovations. I've seen group therapy taking place on online platforms, and sometimes people find it easier to access those. They don't have to go to a room with people that they've never met. Sometimes transport can be difficult, so we've actually found that sometimes more people will join those group discussions where people who have got similar challenges and may have the same mental illness can talk about it, but you don't actually have to meet them. You can meet them virtually, and people sometimes find that a bit easier to do. I've had members of staff working in community teams, walking with patients, and I did a whole meeting the other day about access to green space for people with mental illness, and how that can be therapeutic in itself. And also, people have been visiting people at home and doing consultations through the window, where that's obviously safe and it's private enough to do that, where it meets everybody's needs. And also, I think friends and families and whole communities actually working with people to support people so that they can access the care that they need. That's really important as well. There are lots and lots of online self-help platforms. If you go on to the NHS England website, or you go onto the website for the mental health organisation Mind, they've got access to lots of online platforms, and you can scroll down them and see which one you think would be best for you. And of course, organisations like the Samaritans, who have a particular interest with people who are really in crisis and don't know who to turn to, they provide a 24/7 service for where you can have a one-to-one discussion on a private basis with somebody, and that's an amazing service. And of course, through the NHS 111, you can access a whole variety of different platforms. So that's the single NHS access number, but also they can put you in contact with, for example, with crisis teams for each and every trust in the country. So if things are really very difficult, there's always a way in, and I would encourage people to access the help. Friends and family, self-help, go to your GP, look at some of the online platforms, 111, and of course the accident emergency departments are still very much open. And one of the developments in psychiatry over the last 10 years, there's been a lot of money into what we call liaison psychiatry. So these are psychiatrists who are working not in the psychiatric hospital, but they're working in the general hospital. So if somebody's got a physical health need and a mental health need, there'll always be a psychiatrist on hand to actually provide that side of the help. So medical staff really working together, because we all come with lots of different challenges, and sometimes you can have a physical illness along with a mental illness, and if you treat both side by side, we know that each actually does even better. Whereas if you neglect one of them, then say if you don't treat the mental illness, your physical illness won't do so well either.
Yeah, absolutely. And I mean, thinking about the way that these different issues sort of intertwine, coming back to some of those social issues that you mentioned previously, we know that social problems like homelessness and unemployment are clearly associated with mental illness, and substance abuse as well, and particularly misuse of alcohol. What role do you think communities can play in helping those at risk to identify that there may be a problem, and then to support them in finding the right medical support and social support when it's needed?
I think it's really important that we all ask each other about our mental health. Sometimes that's a very difficult thing to do. I think it's getting a lot easier. So ask somebody if they're okay, particularly if you think they're not behaving in the way that you would normally expect. And I think being very accepting of people talking about mental illness and just listening to what somebody has to say, I think that's really important. If you do notice something about somebody's behavior, again, in a sensitive way, actually asking them, how they are, and asking them, I couldn't help noticing that there was something different about what they were doing, and were they okay with that? So asking a very sort of a gentle opening question, I think, can be very helpful, and then wait to see if somebody opens up. But as you say, sometimes if people are not feeling good, they resort to things that are not good for them. So particularly people in all communities misusing substances, so illicit drugs, and misusing alcohol. And illicit drugs are very bad for mental health. In fact, some of them, like cannabis, can actually be a big contributory factor to developing mental illness. So we would always discourage people from using illicit substances. And actually alcohol, again, is damaging to mental health, and we would strongly discourage people from using alcohol. So, but I think if somebody is slipping into one of those things, being sensitive and using it as a challenge that you need to help somebody with, I think is really important, particularly if somebody is very vulnerable. So actually, a conversation, a two-way conversation, without shutting people out, I think is really important.
Yeah. You mentioned briefly that that there were these close relationships between physical health and mental health, and I think that's really important because they are inextricably linked. We know that people with chronic physical health problems are much more likely to develop mental health problems, and the same is the case in reverse. We're often told about lifestyle interventions that we can undertake to improve our physical health, like eating well, keeping physically active. What sorts of things do you think that people can do to prevent mental disorders or to promote their own mental well-being?
I think there are a number of things where there's very clear evidence that these things actually do work. So staying connected with your community, having lots of links, however that is you want to do. That could be through a faith group, it could be through sport, it could just be organising community activities, but keeping a network. Always looking for new challenges, so always looking to educate yourself, take on new activities that provide you with skills. Giving in itself, so actually being involved in charity work, spending time with somebody who needs extra help and support, that's good for them, but it's also good for you. Taking regular exercise, again, it can be housework, it can be doing the garden, it can be going for a run, it could be training for a marathon, but it needn't be training for a marathon. I cycle in London, I cycle where I live down in Devon, I cycle to and from work, and I find that gives me a very particular sort of space to clear my mind, sometimes also a space to think through something. So I think exercise is really very important, and access to green space. So getting out and about and engaging with nature is really important. So I think all of those things can be very important in staying mentally well. And but they doesn't mean that you could necessarily prevent all mental illness. But and doing all of those things, it can be quite a challenge. We're all very busy. Most people have already got too much to do, and if you're saying for your mental health well-being, do these other things as well, people will say, well, actually that's going to make me feel even worse. And you sometimes do need to work at it, but you get huge rewards from doing those things. So I'd really encourage, so stay connected with people, stay active, engage with community activities, giving, access to green spaces and exercise, all really important. And talk about your thoughts and feelings with friends and family and those that you trust.
That's a really comprehensive list, thank you, and I think that's really helpful for the community. And another aspect of our community is that a lot of people work in healthcare, and they've worked on the front line through the pandemic, and many of them will have also experienced traumatic experiences. And although there has been a huge outpouring of support for a lot of frontline workers, we also know that there has been a great burden placed on them, and also that they're at greater risk. There's a lot of talk at the moment about the workforce, and that was also a key area of your manifesto. And I wondered if you could talk a little bit about how you see the future for the workforce in healthcare.
Well, first of all, I'd like to say a really big thank you to everybody from the Ismaili community who has done so much during this crisis, both working in healthcare, social care, but all those other frontline services. We've got all communities working to keep things going. So, people who have been working in transport, making sure that people are actually getting deliveries, taxis, all sorts of. So all those workers, I think it's very important. It's not just about health workers. So a big thank you to all of you. I think it's good to see that healthcare and social care has been really recognised, and so they should be. That shouldn't just be a COVID thing. It should be something which is always there, because we know that if people feel good about the work that they do, they feel appreciated, and also importantly that they're looked after at work. And I think we've not done enough to make sure that people feel that they're supported, they're properly supervised, they have some control over what they're doing at work, and that they can contribute to innovation, making things better. If you do all of those things, people contribute even better. And I don't think we've done enough to support people in the health environment, but the work environment generally. So that's why one of my 4 priorities is to actually look at each and every individual's working environment and ensure that it's the best it can be. Obviously, work is very challenging. It can't just be great fun all the time, but people can enjoy their work. they'll actually do better for patients. So I want to see proper support packages and proper system so that people can really contribute to doing a better job. And sometimes people feel that the system works against them rather than enables them. And I think we know that people who are able to contribute and innovate, that they do better. And I mean, who wants to go to work in the health service or social care and do a bad job? And we need to make sure that everybody is supported to give of their best and do the very best for patients.
That's really helpful, thank you. One aspect, I suppose, of thinking about workforce is there has been a lot of talk of the future of technology and the use of assisted technology and artificial intelligence, and particularly a lot of talk around genomics and precision medicine. And I suppose there are some concerns from people within the health workforce of what that means for them moving forwards. And I wondered if that's something that you had any thoughts about.
I think we should always support colleagues in research, in looking into the causes of all illnesses, including mental illness, new treatments, because this is what patients want. If you've got a serious illness, you want everybody working as hard, giving you every option to get any treatment. And I think the whole issue of genetics and mental illness is an important one. It's quite likely that genetic studies will be able to identify people who might respond better to one drug than another. That's likely to happen within the next decade. And obviously, if you're that patient and you can have a blood test that might mean that you're much more likely to respond to a particular drug, I guess we'd all want that to happen. I don't see that innovation and genetics and is a threat to health communities at all. I think there's plenty for us to do, and I think particularly in psychiatry, it's a very human specialty. So we do want to make sure we've got innovation, and some of the online platforms that people are actually taking part in consultations with doctors, they've been very accessible, very easy, not so intrusive, so they've been very good for patients. But very often patients, particularly in a mental health setting, they want to actually meet with somebody to have that human part of the interaction. So I think we want to make sure we don't get carried away with the technology and we lose our humanity. So I think that sort of warmth, and sometimes if you're in a room with somebody, the communication is very different. You pick up different sort of cues of how somebody is behaving or how they're thinking, even if you're visiting in their home, what's going on around them, which you can't pick up so easily using technology. So I think we'll never in psychiatry, where I don't imagine that there's going to be a robot doing my job, that they might be able to do some bits of it better than me, but I don't see that's going to take over. But I think so there's room for everything. But yes, we do need to innovate.
Yeah, I mean, I suppose in some respects it comes back to that holistic care that you've already talked about, that you can't necessarily provide that through technology, but the technology can be supportive. And
I think for people in their lives generally, technology is a really good thing. But again, we need to be careful. I think, say, for example, for children, there is concern that if all they're doing is meeting family and friends on a computer, that they're then doing computer games, they're then doing their learning on a computer, and you never meet anyone, that there are concerns about that. So I think we've all got to limit it, and people who are doing meetings from 7 o'clock in the morning till 9 o'clock without a break, and whereas at work you might have been outside of where you were working, you might have been traveling to work. I think we've got to be careful that the technology doesn't sort of overwhelm us and take over. We've got to get the balance right.
You've talked also a little bit about concerns for people who don't necessarily have internet access or don't necessarily have access to that, app-based technology. And I wondered what your thoughts were. We have in this country, as you well know, the Improving Access to Psychological Therapies, which is essentially free counselling and therapy for people referred, either self-referred or by their GPs. But some of that's also provided through app-based services and can be provided on a cloud or online. And what are your feelings about online mental health services?
I think again, there's a lot of evidence that that's an effective way of providing treatment. I think it's good to have it as something which is a choice, so that, for example, if you're arranging some individual therapy with somebody, I would like to see a situation where you would say, well, it could be delivered in different ways. We could actually meet face to face. We could have an initial couple of meetings, and then you could meet online, having got to know each other a bit. And then if in the middle of a series of sessions you then want to actually meet, that's possible. Some people might say, well, you know what, I'd actually rather like to do it all online. There are particular things in my life, other challenges, that if I'm actually having to travel somewhere to be seen, that makes it more difficult. So it's a question of the individual's choice, the individual circumstance. Obviously, COVID-19 has presented particular challenges that have had to be met in a particular way. But as we come out of it, I think it's all about a variety of choices for patients, and they should be in charge of how the care is delivered.
You've talked a little bit around the challenges that you see moving forwards with the impacts of COVID-19 on mental health and the starting point that we were coming from before. What do you see as the next steps? What do you see as the sorts of potential risks for the mental health burden that may well lie ahead? And what do we need to do?
Well, coming into the pandemic, we've already mentioned that services were underfunded. There is more money coming into services in England. NHS England has put more money in. We need to make sure in this country, but all over the world, that we keep the pressure up to put more money into mental health services when things are not so bad, so we're more prepared for a crisis. I think in the time when things are opening up a bit, we do need to make sure that as many people as possible have access to digital technology, because there is quite a likelihood that there will be a second wave and things will close down again. Certainly in some parts of the country, but some parts of the world, but maybe in very big areas. So I think we shouldn't have been in this place in the first place. We need to keep that pressure up, and during the time when things have opened up a bit, people who've got very particular need, we need to make sure that they actually manage to get, for example, to a hospital for either physical health treatment or mental health treatment, and prioritise those with the greatest need. And also the very young and older adults who, again, may find it that much more challenging.
Mm. So one of the last questions I want to ask you about is just about diversity. So you've talked a lot about championing diversity in your manifesto. What does this mean to you, and what are you doing to push this agenda?
We're very fortunate in psychiatry. In the Royal College of Psychiatrists, nearly 4 in 10 of our members are from BAME backgrounds. And so we benefit from a richness of diversity. And we know that organisations that value diversity really value it. They don't just say we do it, they really value it and help everybody to give of their best. They actually do better. So it's not only the right thing to do, it's actually a more effective thing. The organisation does better. And of course, the communities that we serve, the Royal College of Psychiatrists is about patients. It's not about psychiatrists. We're there for patients, are from diverse backgrounds as well by their very nature. So the diversity within a profession needs to reflect the diversity of communities. And again, that's part of breaking down stigma and making services accessible. So I'm aware of lots of disadvantage that people from diverse backgrounds have that makes it that much more difficult to get to where they want to in terms of their working life, where they want to be in an organisation. There's lots of evidence that if you look at the top of healthcare organisations, that people from BAME backgrounds are underrepresented, and they're just as good. So something has happened along the way that people have not been supported to be able to give of their best. So I want to see, first of all, the Royal College of Psychiatrists itself ensuring that all the things that we have within the college, that people can give of their best, people are properly supported, that we've got good values, that we welcome people, we respond to concerns. But within the health service more generally, I want to see programs that actually value diversity and support people to give of their best and get to the top of the organisation. I, as a white man, have benefited from the inherent advantage of being a white man. I mean, sometimes that's kind of it's a difficult thing, because you say, well, I've really tried really hard, but that's the fact of the matter. I have benefited from that. I want to see everybody have the same opportunities, so there's real fairness, and that's really important, particularly in a mental health world.
And a great privilege to have a leader like you that can push that through.
And I want to see there have been lots of reports about this. There's been lots of people suggesting actions, and I want to see us having. I've got 3 years, and I want to see 10 actions in the first year, 10 actions in the second, 10 in the third year, and actually create something that continues to look at this. When I finished as president, I want it to be not something that you think, oh, well, that was dealt with, because I don't think it will be dealt with in that time. It's something we continuously need to look at. We need to make sure we've got leaders who are accountable and take it seriously, that we put funds into running programs and supporting people, and we need to make sure that this is always a voice at the table.
Yeah. Much like quality improvement, I suppose.
Absolutely.
So looking forwards ahead to sort of 2040, what's the one thing that you think that we should all be doing to ensure that our mental health remains in good condition now and sort of for the future?
I think it's about respecting people. I think we need to respect each other. I think we need to talk about mental health. We need to encourage people to talk about their mental health and not see it as a weakness. Encourage people to come forward for treatment. My own, what do? I try to exercise a bit and get out in fresh air on my bicycle, and I support Liverpool Football Club, and they're doing very well at the moment, so that's good for my mental health. But it hasn't always been the case.
No, my husband's a Liverpool supporter. He says the same. Well, thank you very much, Dr. James. This has been a really useful discussion and very helpful for us to understand these insights of yours. I think I'll close it there, but thank you very much.
Great. Well, thank you, Selina. So it's been a real privilege for me, and I've really enjoyed it. So thank you.
Great. Thank you.